Well, to piggyback on kind of some of what I've shared earlier, it's really about understanding your workplace dynamics and acknowledging that, again, in order for your people to thrive, you have to give them the tools to do so. And so some of the work that we do at Healing Without Limits is we help corporations infuse mental wellness into their company culture for success. And we do that work by doing organizational assessments to understand the lay of the land and then helping them build strategies to address whatever they're presenting issues. And so whether you work with us or someone similar, really understanding what is your organizational health and then creating a plan informed by those
Workplace
results.
mental health is this idea and concept that in your workplace, you're focusing on infusing mental wellness into your company culture. So it's the practice and the idea of how do you address mental health in the workplace. Historically, organizations have been very good about addressing physical health, having programs and different initiatives to encourage physical health. And so now that times are evolving and there's more emphasis on mental health, is this idea that you do the same, but from a mental health
I
perspective.
may add, I think the key is understanding those communities, and it goes back to culturally competent care. So when we talk about Black women, oftentimes in the mental health space, we talk about the strong Black woman narrative and what that does for a woman of color's mental health. When we talk about older adults, we need to talk about the things historically that has happened that has caused them to approach mental health in the ways that they do. And so it's really important that we understand these specific populations and we have specialized care that can address their unique needs.
The emphasis today is that people are more unapologetic about their needs around mental health. There's more education around it, there's more conversations about it, and people are not as afraid to say, this is something that I need and I expect of my workplace. So, with that being said, it is really impacting organizations from a talent standpoint. Recent stats stated that 81% of people stated that they will look and see how organizations support mental health before they choose their next job. So, with that being almost 100% of people, that's very significant. And so, um, the second part of your question is about organizational health and employees. In order for anyone to be successful in anything they do, they have to be well. If a person is not well, then it's going to impact everything they touch. So when we talk about mental health, when someone is not well mentally, it's going to impact their ability to concentrate. That's going to impact their ability to maybe even get out of bed, right? Maybe we should start there. Just their ability to get out of bed. And if they do make it out of bed, are they showing up the best version of themselves? Are they able to again concentrate? Are they able to be innovative and creative? Are they able to even get along with coworkers? Right? If they're a leader, are they able to lead up to their full potential if they're not well mentally? So it's very important to know that in order for you to do anything well, you have to be well mentally. So that directly relates to organizational health. Organizations want their employees to do well, employees want to do well. So by taking a wellness first approach and culture, then it can help organizations reach new heights of success.
Certainly, second, that there is a policy component to addressing the systemic challenges in the private sector. But additionally, Healing Without Limits was fortunate enough to do a multi-year project with the United States HHS to help the federal government advance the behavioral health system at the federal level and reduce overdose deaths. And with that, we've seen firsthand that Biden's administration is putting a lot of funding into private and public sector organizations. So if you are a private practice and you're looking for a grant to be able to provide your services to people, potentially free of charge, if that's how you choose to do your model, that is opportunities that are coming down from the federal level. So I encourage private practices to keep an eye out from SAMHSA and the work they're doing in that space.
Due to the pandemic, we have seen increase in again, the conversations around mental health in the workplace, what that looks like. And we've seen organizations enhance their benefit packages. I think the recent stat is around 70% of organizations have done something to some type of change to enhance their benefit packages. So we're seeing more conversations about it. We're seeing that it's clearly a link to overall business success. So we're seeing that conversation more and more. And I think what is also happening is companies are kind of trying to figure out what is the right solution. Is it the right solution to do a training? Is it the right solution to try to do more healthy activities? Is it the right solution to bring in a mental health consultant to kind of help assess what's going on? Or is it the right solution to look at the existing or historical workplace wellness solutions they've attempted and see how they can complement or enhance? So I think leaders are in a unique space where they're looking and searching for the answers and what's right so they can best support their team.
Everyone for your participation.
Yeah, absolutely. It's so good to hear from you guys all. I know we don't have time to go through traditional introductions, but it's very good to meet you all and also to learn a little bit more about you and what you hope to gain from today's training. So now that we have went through introductions, we are going to go through some basic definitions and common words and phrases that we will talk about today, but you also probably hear throughout your workplace as well. And so we're going to lay the foundation about what is mental health and why is this so important? Why are we hearing this be talked about so much in workplaces? So the definition of mental health is a state of your mental well-being that enables you to cope with the stresses of life, be aware of your own abilities, also known as insight. Your mental health enables you to learn well, work well, and contribute to your overall community. Now, oftentimes people use mental health and mental illness interchangeable, and these are not interchangeable. Mental health is something that everyone has. Mental illness is actually a health condition. This involves a health condition that has to be diagnosed by a licensed mental health provider, and this involves changes in your emotions, thinking, or behavior, or a combination. Mental illness can be associated with some form of distress or just having challenges in your relationships at work, at home. So again, people oftentimes use mental health and mental illness interchangeable, but they're different definitions. And it's really important to note that when we talk about mental health and why this is so important in the workplace is because when you have with your mental health, you could have mental health concerns and not actually meet the criteria for a mental illness. Say, for instance, you have some type of trauma you experience or life is just hard, you can start to have mental health concerns. And what that can look like is you're having issues with your appetite, you're not sleeping as good, you might become more irritable, you may have issues with concentration, the list goes on. And so the reason why it's really important to understand how to cultivate a mental health inclusive workplace is because if people have mental health concerns, they can start to have challenges within the workplace. Also, it's important to note that people can have mental illness, but they can actually have a healthy mental health. And when I share that, that oftentimes shocks people is how do you have mental illness and you have a healthy mental health? Well, the reason is that people can have mental illness, but they take good care of their mental health by going to a therapist regularly. If they have a psychiatrist and they get medication from their psychiatrist, they stay on top of that, they actually can recover and have a healthy mental health. And so it's very important to note that someone can have mental health concerns and don't meet the criteria for a mental illness, and individuals can also have a mental illness and have a healthy mental health.
There's a lot of tangible benefits. One is reduced turnover. So the idea is that if you are taking good care of your people and you are supporting them from a holistic standpoint, they're more likely to stay. So you're going to save costs on turnover because you're retaining your staff. When someone turns over, it costs a company around 70% or 75% of that staff member salary salary to make up from lost productivity, to make up from recruitment costs, to pull your best talent to train them, the cost that you incur from an HR standpoint, just getting them up to par to be legally able to work in your workplace. So you're going to, again, save costs on that turnover. Also, disability costs, workers' compensation, loss of productivity. Companies have been losing around $300 billion in the US because of lost productivity, workplace stress, turnover. So it is really significant. Also, another really big part is saving money on insurance costs. Recent research has indicated that organizations can save an average of $1,400 per employee per year on their insurance if they invest in some type of mental health workplace wellness program. So for a company of around, let's say, like 350 people, that can be a few $1,000,000 in savings when you add up all those numbers and look at average costs of the staff members. So it's pretty significant, the savings you can see if you invest in a workplace mental health program.